Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is an overview of sacroiliac joint pain. There are two SI joints in the body known as sacroiliac joints. At the bottom of the lumbar spine, it meets up with the sacrum, and those meet up with the ilium on both sides, which are part of the pelvis. So sacroiliac, sacroiliac. The SI joints do contain cartilage, and they have slight movement when we walk of 2 to 4 millimeters, nothing like a hip or a knee. But degeneration can occur just like other joints that have cartilage. So the SI joints show 12 to 25% of the time as the cause of low back pain. So it's not something that we think about all the time, but your low back pain may not be coming from your low back. It may be from your SI joints. It can also cause referred pain in the low back, buttock, hip, or leg. Initial treatment for SI joint pain should consist of over-the-counter pain medications such as anti-inflammatories and Tylenol. Narcotic medications for the acute exacerbations can be very beneficial. Physical therapy, chiropractic treatment, TENS units such as you see here, about the size of an iPod. They're battery powered. They have these foam pads that emit slight electrical impulses through the skin, and they can change the way the brain perceives pain signals. Ultrasound, massage, even prescription pain creams can be very beneficial. Interventional treatments can consist of trigger point injections for muscle spasms and aching. SI joint injections are done under fluoroscopy so the pain doctor can see exactly how to get into the joint. There's also lateral branch blocks. You have the medial branch blocks for neck and low back pain, but when you get into the sacrum, it's actually the lateral branch, little nerve endings that provide sensation to those joints. So that's, instead of doing it on the inside, you're doing it on the outside, the lateral area. And if a lateral branch block works well and then wears off, you can either repeat it or move on to a radiofrequency ablation. An RF procedure is done by heating up the lateral branches. You can see that there's a probe that's put in, thermal energy is put through it, and it deadens these little lateral branch nerve endings that provide sensation to the joint. Over 50% of patients achieve at least 6 months of considerable pain relief with radiofrequency ablation. The procedure can be repeated when the pain relief wears off. It's an outpatient procedure, very low risk, and it's increasing in popularity every year. In Washington, the top pain management is through the Washington Pain Network. There's multiple clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rate is over 90% with the board-certified award-winning doctors. Visit us online today at WashingtonPainNetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.